Hey guys, as you guys can probably tell from the title of this video, I got COVID-19 and I've been trying to make this video for about a week, but every day has been kind of a struggle. It's been getting better, but I just want to give you guys some updates about how it's like having COVID and what my opinions and thoughts and symptoms were. So stay tuned. For those of you who are new, my name is Edgy and I'm a pharmacist and I enjoy making videos about anything pharmacy related, whether it's medication or any other healthcare related topic. So make sure to subscribe for more content. Now to the rest of the video. Currently at the time of this recording, I'm on day 7 of being tested positive for COVID. I originally wanted to make this video on day 2 because on day 1, before I got tested, I was having a light dry cough. And I started feeling a little bit fatigued, so I went and got tested and the test became positive. But at the moment, I wasn't feeling too fatigued in the sense that I can't be productive, so I can't do work. I felt like I didn't have that severe case of COVID, that because different people respond to it differently to COVID from what I've seen. Some people respond much worse, some people respond much more mildly. We don't know exactly why that is. I have a couple theories, which I'll talk about in the next upcoming video. But in my case, I'm like, oh, I'll feel fine. I'll make a video the next day talking about how I got tested positive for COVID and how I'm feeling. Now the second day came and I started getting a much higher grade fever, much more body aches, and my taste was severely diminished, and my sense of smell was almost absolutely gone. Even right now, I do taste a little bit, but sense of smell is like virtually gone. I haven't really smelled anything for the past week. Now, furthermore, my cough worsened the next day. So those are my general symptoms of having COVID. So fatigue, loss of taste, loss of smell, fever, body aches, and cough. Now, right now, I'm on day 7. Day 7, I feel more energized enough to make this video. I still have a dry cough. My sense of smell isn't back yet. My sense of taste is kind of back, but not to where it was before. But I do feel a lot better physically. Like I'm able to walk around. So for a couple of days, in the first couple of days, I was basically in bed for most of the time. I didn't take any medication because I didn't feel the need that I was in that severe of a condition. I did take Tylenol, so acetaminophen, to help reduce my fever. I took that on day 2, 3, and 4 because I was having chills a lot sometimes. So I'll be okay, and then maybe right before bed, I would get chills and a fever, so I would take a Tylenol to help me sleep better so I don't wake up in the middle of the night freezing. Also, I bought a pulse oximeter, so it's a machine where you put it on your tip of your index finger or any finger, and it tells you your oxygen saturation. Because I was having a lot of coughing, I was getting a little paranoid about, wait, what's my oxygen saturation? What if I need to go to the hospital if I'm not getting enough oxygen? But it turns out it was more of my nervousness or anxiety of the situation, which, because when I got the pulse oximeter, my pulse ox saturation was like 98, 99, 97%. So I was fine in that department. In terms of how I treated myself, I would say I took care of myself very well in terms of I got a lot of rest. I try to eat as much as I can because I didn't have a sense of taste, and also because I had a fever and body ache, I had a loss of appetite, so I wasn't eating much. So I don't know if I lost weight or not, I can't tell yet. But I was eating less, so I was feeling very fatigued, and I don't know if that was because I was eating less, or was it because I was sick and that why didn't have much energy. Maybe it was a combination of both. I don't know. If I get more updates, I'll tell you guys. But as of right now, I am eating relatively normal diet, breakfast, lunch, and dinner. I do feel more energetic. So I do feel confident that the worst is behind me. But furthermore, in terms of treatment, I just took vitamin D and zinc, and then vitamin C. And vitamin C could have came in many different forms. Whether the tablet I took, or maybe I ate a lot of oranges and other fruits that had higher concentrations of vitamin C. That's mainly how I've been treated. If people ask me, oh, why aren't you taking azithromycin? Why aren't you taking ivermectin? Those medications, like I said, azithromycin is a main antibiotic, but a lot of COVID patients take it because it has some anti-inflammatory properties, or dexamethasone is to help reduce the inflammation if you're having trouble breathing. That's why I was monitoring myself with the ox meter, because, for example, if my pulse ox got below 84 or 88%, then that might be a condition where I would want to take dexamethasone, because to help reduce that inflammation, to help me breathe properly. But that's, of course, has to be prescribed by a doctor or a physician. But it was just my mentality or my judgment of the situation for myself. For those of you who are wondering how I got tested, I did a PCR test, and we do that at our pharmacy. How it is basically you want to cough, and you get a con swab. You swab the inside of your mouth, and you put it in a tube, and then we send it to a lab. And that lab does PCR, which it basically amplifies the virus to check for detection. And so for me, I did that test. It came out positive. It's relatively more accurate than other tests, much more accurate than the rapid testing, but it does take a little bit more time. For example, our lab gives a 24-hour lead time, but like results typically come within like 6 to 12 hours. But that's how I got tested, and I like that it was a very accurate test, so I knew if I was gonna isolate, it was gonna be I wanted to make sure it was COVID-19. And then about isolation, I want to talk about. So one of the hardest things for me personally was isolation. So being isolated in a room for now, that was like the 7th day, is not an easy task at all. Especially for me, I'm a very productive person, so I like to either get things done or go out and have fun or just do something. So being stuck in a room for 7 days without exercise, without seeing anybody, is not an easy task whatsoever. Mentally, it is draining, because I don't even know what day it is anymore. I wake up, I do the same thing. I try to find things to do to be productive. I've been trying to make this video, like I said earlier, but it just takes so much energy to like set up, and then also like to speak in front of a camera. When you have a fever, when you have body aches, it's not the easiest thing to do. And I also want to keep the quality of the videos up to par. I don't want to make like a low par or low quality video and have it suffer for the channel. But in regards to trying to feel productive, I've been working on like the business a little bit more. I've been just playing a lot of video games. I've been playing a lot of Nintendo, and I also just been watching a lot of movies, Netflix, just the whole like same spiel. I have the luxury of being able to stay home and in a safe room, which I am very blessed for. But it has been very hard to stay home. My plan is, which is the same plan as what the CDC recommends, is the CDC recommends that you do isolation for 10 days after the symptoms appear. So if my symptoms appeared on day 0, on day 10 is when my isolation should end. If and only if I have 1 day of without any fever, without any medication to help reduce fever. Meaning, let's say 10 days has passed since I've been tested positive for COVID, and if my symptoms are improving, of course, and I have 1 day, so probably the 10th day, that I have no fever without taking Tylenol or any other fever reducing medications, I am now could end isolation. So I'm almost there. I'm about like 3 or maybe 4 more days out. I might give it an extra day just to be a little safe. But the majority of the COVID recovery and the isolation is behind me, which I'm excited about that. But that's my plan going forward. I do feel better right now. I still have a slight dry cough. My fever is relatively gone. My fatigue is relatively gone too. I still feel a little tired, but I don't know if it's because I've been stuck in my room the whole week or just because of COVID. I can't tell right now, but I do feel physically a lot better compared to day 2, 3, and 4. So I'm very excited about that. And I'm also excited to hear what you guys think, or what are your symptoms if you had COVID. Was it as similar as mine? Was it worse? There's a lot of people who have, unfortunately, worse symptoms than me, but there's also people who have less symptoms. I know someone who got COVID and she never even had a cough. She just had like a haze. She felt like hazy, or she had a headache. So it wasn't as severe as mine, but there's a lot of other severe cases, which I do have a couple theories about why that is, which I want to make in the next video. But let me know what you guys think. I hope you guys enjoyed this video. And for my long-time subscribers, this is like my old room where I used to record my videos previously before it was at the pharmacy. So a little throwback here. But make sure to comment, like, and subscribe. Until then, I'll see you next time. Thanks.